Hello guys, welcome to another fantastic moment with our own girl Tomi. And this is a special edition. You are like, who is that at the background? You guys are in for an amazing moment. I'm here with Dr. Akin and we are going to talk about women's health. I know this is this is the very first time we are doing something that is not entertainment, and it's good to have you on. It's not hangout with Tomi, but this is actually on that unscripted part of me. This is the unscripted part of me. Today I want to discuss something that is very important to women. Everything talk when we're talking about women, I think everything about women over these years have been like we are always at the receiving end and we have a lot of questions. Trust me, I have a lot of questions to ask doctor today. And he will be doing justice to some, not all. Dr. Akin. See, Dr. Akin has an incredible credential. When I was reading about him, I'm like, Akinode, she we went to secondary school, so I don't understand. All this is a clinical, is this and that and Igba and Awo. Please, without much ado, please welcome Dr. Akinyemi Gabriel. Hey, orúkọ yẹn pọ̀, it's very long. Doctor, you are welcome.
Thank you so much.
Popularly known as Dr. Akin.
Yes.
Doctor, see, I have a lot of questions here. People, sure you see, I'm holding my white. You know, when I hold this thing, you know it's a serious matter. And my pen. Hello. So, doctor, why is it that women are always at the receiving end of everything? When you get married and there's no kid, there's every possibility that the mother. No, sorry, I'm not taking offense. Now, everybody will think that is the wife okay? Is she fine? Have they gone to this place? It's always the women. We are the one that we have menstrual pain and we can't go to class and things will happen. And do you get? So why is it that women are always at the receiving end of everything?
Thank you so much, Madam Tomi.
Do I look like a madam?
Thank you
I
so
look
much.
tiny, right? But you are telling someone big.
No.
Thank
When
God
you're
you
somebody big, I'm not big too now.
But thank God you have seen me on Instagram, so it's not like you have seen someone different. And this I look like on Instagram, right?
Yes. Yes.
Thank God. So me.
I mean, my face has changed, I guess. Yeah, basically, women go through a lot. When I tell you women go through a lot, women go through so much that if you are not in the field of women's health or women's care, you won't know so much what they go through. Basically, the question you have, that mentality comes from the school of thought that, from a culture-induced school of thought. Culturally, it has been like that. Whereby women are always at the receiving end of
Everything.
health issues like, why have you guys not given birth? Yoruba would just say, kill and draw day, things like that. Why have you guys not conceived? They won't ask the guy, like, what's happening? Is the lady they will ask. That's why women should be cared for more. One time I made a post, I said, women go through so much that men need to be very sensitive to what they go through. It's high time we need to be very sensitive to what they go through, period. And that was a post. Because I just sat down and thought of it that women are the receiving end of everything, infertility, women, emotional issues, women. Men go through too. Don't,
You should not take men out of it.
Yes, but I think women go through more. In statistics, global statistics, we know that we have more women in the world than
Going through stuff.
And going through stuff more. Name it. Men, we have this natural strength to carry things on our shoulder, but women always want to lean on, and in fact, we have women right now that they are now carrying things by themselves, but it's let's say, would I say it's wrong, but they have been shaped into that mannish, structured into that mannish, thing and all that.
Manly. Okay. So talking about medical science and ancient healing, we talked about that recently. Dr. Akin was on IG Live with
Lepasius Bosse.
Yes, with Auntie Bosse, and they, in fact, and I do like the fact that I couldn't attend like to the end, but the little I attended, like I was on the live IG live, and doctor was just saying a lot of things about what we eat, and do you think
Yes.
that we women eat? You say we eat dairy things a lot. That are those things that we eat, if you want to call it that, are they the reason for the problems we are having sometimes?
Um,
You said that
Thank
we
you.
eat a lot of sugary things, all these
Yes.
things. I mean,
Yes. Let me start from the fact that you mentioned medical science and ancient knowledge, ancient wisdom. That is what I do. I'm a naturopathic physician, and you know, some people, fans call me, oh, Dr. Akin is a naturopathic physician, a women's health practitioner, and
women's health.
yes, and my specialty in naturopathic medicine is reproductive health, ADHD, and oncology. And I try to make them understand naturopathic medicine is a branch of medicine that talks about self-inherent healing ability, the ability for the body to heal itself. The body has this capacity, ability, capability to to heal itself, to kill that bacterial infection. The body has the ability to restore back that neck pain. The body has the ability to restore, to heal your eyes.
Really?
But you have to give it that thing. You have to detect what went wrong so that you can give it that thing so that the healing process can start. So that the and this comes with medical science, because in medical school we do anatomy and physiology, we do medical biochemistry, medical microbiology, we do a lot of clinical science, clinical medical courses, name it, then we are more, we come to a resolution that okay, you know, we are medically trained, but we come to a resolution that we need to look into this
Natural medicine.
natural view, natural medicine. Now, when I talk about natural medicine itself, hmm,
It's not being an herbalist.
it's no,
It's
no,
not
no.
saying
When you say
natural
natural
medicine.
medicine,
It's not like
no, there are people that have PhD in medical herbalism. There are people that have master degree in medical herbalism,
you see
but we
what I'm
just don't
saying.
know. It's because you don't meet them. There are people that have masters in medical herbalism. There are people that have PhD in medical herbalism, but they are still different from a naturopathic doctor. Now, there are three major branches of medicine that are known to the global community, that are approved by the WHO and also approved by the Federal Ministry of Health in Nigeria. And these medicines are divided into three major strata. Now, the first strata is the orthodox, or called Western medicine, or called allopathic medicine. This allopathic medicine itself is it's based on medical sciences, but a lot of time we see that there are so many questions without answer.
Mm.
There's so many cases. There are so many. People need life. People need hope.
Mm.
People need to be healed. People want to be well. And when you have a practice whereby that tells you you're going to die in 7 days time or 10 days time because you have a disease condition that warrant that, that's where you begin to look into alternative, or what else can be done. What can you do? What are the way out? What are the other ways we can go about this thing? That's why you have complementary and alternative medicine, which has five major branches. We have
Hey, doctor.
naturopathic medicine, homeopathy, chiropractic medicine, osteopathy, and medical acupuncture. That is the five major branches of command. The third one
Okay.
is the common traditional medicine. So it's
Okay.
different.
Okay.
So this calm medicine is based on medical science.
Okay. It's not.
It's evidence based.
Okay. It's what you can
So
see. Is
even
what
calm
you do.
doctors prescribe in naturopathic medicine, the training that we have, and that training is so in the US and UK. Naturopathic doctors can prescribe tablets and other things.
Okay.
You understand? Even naturopathic doctors conduct minor surgeries and all that.
Okay.
Because
Like
when
CS.
sometimes, no, not CS. CS
Okay.
is a major surgery.
Okay.
But
Okay.
when
You
you talk
get
about
it.
minor surgery, probably the woman is, you know, you know, there's childbirth,
Okay. That's
process going
okay.
on,
A natural birth.
natural birth. You know, we would have put everything in place to make sure natural birth is possible, is successful. We make sure we monitor the child from the first
So you
gestational
are different
age.
from a gynecologist.
No, we have our own. I'm a gynecologist in my own field of
Okay.
naturopathic medicine, women's
Okay.
health.
Okay.
We just don't want to call it, but we call it women's health to
Okay.
pack it all.
Okay.
You understand?
Okay.
You understand?
Okay.
We pack it all. What will Gani is a women's health physician.
Mm.
You understand? That is where I am a Gani in my own field
Mm.
of naturopathic medicine.
Okay.
But we just don't put it that way. You understand? We just try to be more closer to our patients, be more closer to you. You understand? By saying women's health, it makes it simpler. It makes it more closer to women.
So now let's thank God we have narrowed it down to women's health.
Yes.
Now I have questions. Doctor, what is the main cause of menstrual pain? I was asking some kind of guys, I want to interview one doctor. Say, Tomba babe. I was to ask because sometimes it is what you eat. So people don't even eat sugary things and they still have severe, like a very severe menstrual pain.
Yes.
What do you think? What is the cause? I don't want you to say what do you think because I know you're a physician. You can tell us what causes this menace. It's a menace because some people don't go out when they are on, and it's not good.
When we talk about menstrual pain,
Mm.
I want you to understand something that we look into. This is my medical practice, naturopathic medical practice. Naturopathic medicine has its own principle, its own guide,
Okay.
like a rule, a brochure that we follow. And in one of those guide, we call it principle of naturopathic medicine. One of the first principles is, you know, making you understand that the body has a self-healing ability. Second is identify and treat the root cause of disease. When a patient has, painful menstruation, dysmenorrhea, and
Dysmenorrhea, yeah. That's
painful
the name.
menstruation, and this this is something major. There's so many things that can lead to painful menstruation. You understand? We now conduct tests, conduct a lot of, we do blood work, we do um, ultrasound scan to confirm, to know the cause of the pain, the menstrual pain, the dysmenorrhea, to know. Along the line, we discover it might be PID, severe PID,
What's PID?
pelvic inflammatory disease
Okay.
caused by infection,
Okay.
bacterial infection, any kind of infection can cause the pelvic part of to become inflamed and when it becomes a disease, we call it pelvic inflammatory disease.
Okay.
It can be acute, it can be chronic, and it can be. So these are things that we need to know. So this can lead to painful menstruation. The other things that lead to menstruation, even fibroid leads to painful menstruation, can make cause pains, can cause severe pains. You understand? Myoma, so many other things can cause. It is now left for the um, the doctor, the physician, to do proper investigation to arrive at the cause. We are more interested in the cause. We will not just we will not just tell you to go and take care and adjust, or to
Okay.
just go and take care because you are feeling pain. We don't see medical as management. We see it like there are a lot of people to take care of, to treat, to. So
You go to the
we
root.
go, you understand, we go deep down, like pastors will say, go deeper. You understand? We go deep to know the cause of the problem. Then how do we go deep? We still use the same medical science, the same.
To find
A
out.
lot of our doctors are, a lot of our colleagues, allopathic colleagues, we discover that the word patient means for both doctor and the patients to be patient, to arrive at, you understand, to
You
arrive,
understand, doctor, again.
to get the real healing, you understand, phenomenon to occur.
Okay.
So when you are not patient, to carefully look into the cause of the disease, you will just be managing. Management is not healing.
Okay.
A lot of people ask me, doctor, how do you do disease reversal? Yes, I do disease reversal. when you have cases of hyperglycemia and all that, high sugar in the blood, we have a way to do it. Before it gets to type 2 and all becomes defined, and you have to stay on a medication to manage it, we take it at the earliest.
Stage
We do more of preventive medicine.
than
Yes,
managing.
than management. We like it when it is fresh. We handle those cases when they are fresh. It is easy. That's where we get the good results from more of the time.
So meaning that people should do their
And
medical
sometimes, do you
checkup
know
all
that
the time.
sometimes the food you eat can make you have menstrual pain? Let me bust your brain. The food you eat can make you have menstrual pain every month. We have done, yes, we
What
do.
kind of food is that?
That is
Because I'm very
why,
sure people will be
yeah,
interested
that
in
is why
knowing
we
this
do
kind of
food
food.
assessment. That's why the naturopathic doctor do called dietary assessment, which is
I
not
think I
common in
saw
the
something on
allopathic.
your page the other
Yes.
day. It's a pity I wanted to comment, but I don't know what happened. Maybe something happened.
Allopathic doctors don't do dietary assessment, but we ask you a lot
What
of,
have you
okay,
been
okay,
eating?
let me let me tell you a few of my clinical experience when it comes to food that is known, that something that are common thing.
Okay.
You know that now, if you see any person that has um ulcer pains
Okay.
and tell you, I have ulcer pain, ask them, are they eating beans? They will tell you yes. Mm-hmm. I have three.
So can beans cause?
Do you know that I have a friend that was there that was like, yes, these beans that we are eating now in this country
Yes.
can give you ulcer pains.
Okay.
Now, hold on, because of the preservative used for preserving the beans, these preservative chemicals are beginning to affect our health. This is the time we need to start looking into these things critically. That where are this disease condition coming from?
So,
Nǹkan tá à ń jẹ ló ń fa àrùn. What we are getting disease from what we are eating, from what we are drinking.
but
So
normally
even
I can't
this
think that
issue of the menstrual
beans.
pain now can be caused by eating late night foods.
Wow, really?
Yes, the time you eat matter. What you eat matter. You
The
cannot
time
eat.
you eat matters. What you eat
Yes,
matters. Like you said on Sunday, you said you are what you eat.
you are what you eat. What you eat is what you become. Your lifestyle is you.
Wow. So if you eat late, guys, ladies,
Imagine
usually
some people will be
don't
soaking
really
garri
do.
at night.
It's
Some
not
ladies
good.
will say they don't have, and they end up having these pains.
But some of us
Some will
that don't
eat
eat
beans
late in the
around
night,
11.
people say that's why we are like this because we don't want to eat late at night because we don't want to feel uncomfortable maybe.
No, you understand, even if you're not an health care practitioner, you understand the meaning of good health. That
Eating
ìlera lọ́rọ̀.
yes, health
Good
is
health
wealth.
is health, wealth. So if you understand, I was telling a friend of mine was telling me, you don't want to even, you're always looking, baby face. And I said, what is the advantage in fat? You
Eh,
understand? I'm not trying to discredit
and we are not body
our
shaming
beautiful,
anybody.
body
Curvy.
shape, curvy, but
If all of us want to be curvy
you
sometimes.
understand.
But I'm
But
fine.
when the weight begins to affect your health, it becomes a concern. That is what we talk about.
Okay.
That diet and lifestyle is key.
Diet.
Diet and lifestyle is key.
So we should not joke with
Diet
the
and
kind of
lifestyle
food
is
we
a
eat.
major cause. I have doctors as patients in Nigeria, radiologists as my patient,
Wow.
MBBS as my patient, radiologists, consultant radio
Wow.
on infertility case, on different cases. But when they hear me talk and I explain to them these things, they overwrite it, they don't care. But I make them start thinking about it, that I have to begin to look critically into my diet and lifestyle.
Looking
The way
critically
I
into
eat, what I eat, the time I eat is very important. See, some people can swallow a big bowl of eba. It's not right. Not that they will have diabetes or they will have any problem. But sometimes they have to understand their anatomy, their framework, that this
it.
is what my body can digest, can metabolize.
But some people think that I'm hungry, let me just eat
You
because I don't know
understand?
what will happen today. Oh. Maybe I will have to go all
Tomi,
out
let
today.
me let me bust your bubble. We care more about our skin than what
Sorry.
we eat internally.
Ladies, doctor is saying that we care much about our skin,
We
flawless
care
skin.
much. We care much more about our skin than what if you are careful about sunburns and other things, using screen and other things, and you're not careful about what you eat and drink internally. I think it's so pathetic.
Okay, so
And that is why
do you think that women are, we are having, our priorities are not right? Like, I think we place more priority on our skin more than
I
what we
think
eat.
is now
Some women,
a
right?
doctor called me from California and he was asking me similar thing. And I said that we care less. I think I now told him. I said, Dr. Jackson. I said we need to be health disciplined. That was the language I used.
Health discipline,
We need to be health.
not skin
We need
therapy.
to create health restrictions, healthy habits. Understand the habits that are healthy. A lot of things we know these things. They are not new to us, but we are not disciplined about it.
We just think that good health is we just
We
come.
just take it for granted and leave it to God to do everything.
Mm,
God can do everything. It's omnipotent. But He has given us wisdom to take care of ourselves.
as well.
And we know this thing, but we don't do it because we are not health disciplined. Tomi, that is the fact. And why I'm saying this, our women need to, because the rate of women with different diseases is becoming alarming, ranging from infertility. See, do you know that you can correct infertility with diet and lifestyle?
Wow.
Do you know that people pay me so much to create diet plans for them every month that will help them to correct their cycle
doctor, you are not a
properly?
dietitian.
That is
How
what you
come?
don't know. The work of a dietitian is different from my work.
Okay.
I'm a physician.
So you can
My
still
own,
tell us.
no, it's not about still telling you. My view of medicine, I studied medicine, I studied food as medicine.
Okay. So
So
you
it's
can
an
prescribe.
healing.
Okay.
It's an healing, it's fashioned towards healing.
Healing. Okay.
You
Okay.
understand?
So your work is different from a dietitian.
It's different. I did clinical nutrition. You understand? As part of my curriculum.
Wow.
You
Clinical
understand?
nutrition.
You understand? As part of
I
my,
mean,
so it's not just a dietitian just telling you,
okay, eat rice in
don't,
the morning.
no. We go deeper.
Mm.
The carboxyl group, the amino group in the food,
But doctor,
and look into the pathways and other things, the way the body biochemistry and all that.
some people like some of the people that I spoke with before this interview said, sometimes you want to obey all the rules of doctors and everything. You don't eat anything because they say rice is not good, beans is not good. So this one is not good, this one is not good. So what exactly should we be eating, doctor?
Um, what I will tell you is this.
What should we eat now? Because
Now
then we
look
are
for a
what to eat.
naturopathic, yes, physician around you or closer to you to chat up, to do we do what we call dietary assessment.
Okay.
And this dietary assessment, what works for A does not work for B.
So you can't
Tell me, if
generalize.
you are a twin and your twin sister, what the dietary assessment I'm going to do for you, the result will be different from your twin sister. So and what we do again is we create an individualized treatment. You have malaria, your friend has malaria. I'm not going to give you the same medications for
Like
malaria or
Pastor Mo, the
remedies
two
for
of
malaria.
them.
No, I will look at other things that will still take care of that malaria. And we do more of helping the body to heal itself. We know what to do, and this is a medical view to
Medical.
it. Yes.
Doctor, fibroid. What is that thing that is causing fibroid? That I have, there's someone that is close to a friend of mine. We were thinking she was pregnant, and she wasn't pregnant.
Myoma.
And he said, I mean, everybody was even thinking she was pregnant. I'm like, I don't think she's married. I don't think she's pregnant. And before I know it, we were told that it's fibroid. And later, we didn't see that again. And he said, I've done the surgery. And sometimes again now, the tummy is out. And I'm like, what is this? What is the cause of
Thank
fibroid?
you, Toby. Majorly, a lot of women that are going through issues of fibroids.
He said
Majorly,
my Tomi something is not the solution to fibroid.
basically, it's not a solution to infertility.
To infertility. Okay.
Because a lot of times when you have fibroids, myoma, myoma, and you're and you are told to go for myomectomy. After a lot of them, when they come to me and they tell a lot of those people, they will tell me that my doctor before told me, my allopathic doctor told me to go for, I did my myomectomy 2 times, 7 months. After when once I finish my myomectomy, I will conceive after 3 months, and I don't conceive. Now, that's why what we do in infertility, my own view of medical practice, naturopathic medicine, we look into the cause. You understand? So the cause of fibroid, like you asked me,
Yes. What is
itself is when you have excess estrogen and low progesterone, hormonal imbalance is the major cause. Hormonal imbalance is the major cause. Endocrine disruption. When your body hormonal profile is tampered with by your diet or lifestyle, because those are the major things, and also environmental factors. I'm doing a study right now. How your roll-ons, your perfumes, how these things, they are chemicals. They affect, they cause endocrine. There are chemicals inside as part of their component that causes endocrine disruption.
wow? So
That
those things can
can
be
that
harmful.
can make you that can give you hormonal that can make you be at the risk of having hormonal imbalance. So that's lifestyle.
Why is it that? Why we
Do you know that I
hormonal?
started using baking soda as my dry baking soda as my own roll-on.
Try baking soda.
These are things that we do because that we have this secret. We have them. We know them. You understand? You can't study, you can't be in a field and not know the field. You understand? We practice every day. You understand what I'm talking about?
Yes, doctor.
So when fibroid issue is becoming alarming in black women, and I tell one of the ways to prevent fibroid is to start educating our children. Let Instablog carry this one. Let educate blog,
I feel these are something that is
today not carry this one. That
they are
one
not.
of the ways, one of the major things that we can do as black people to stop this issue of fibroid growing is to start educating our children at age 18, 17, 18 on preventive medicine when they're in puberty. To start telling them at age 13, 14, 12, 13 that there's something called fibroid. I mean, our girls that becomes women, that become women, that become, that there's issue that there's something called fibroid. And for you not to have fibroid in the future,
These are the things
you have to start looking into your diet and lifestyle. Until we start investing a lot of awareness into preventive medicine, the fibroid rate will not come down. Because myomectomy is not the solution. You get my point? Why it's not the solution is that most of the time, the case is always infertility as presented, either primary or secondary infertility. You understand? And you have fibroid, and you're advised to go for myomectomy. These are not solutions. If you look at, most women are not ovulating, and they have ovulation signs. But if you go for egg tracking, they are not bringing out any eggs. Some of them, their eggs are even immature. Some of them will not. These are technical, medical things that we see going on, and they all boil down to hormonal problems. They all boil down to hormonal imbalance. Are you getting my point? So these are basic things. That's why it's a major concern. That's why women are going through a lot of emotional and social issues, health issues, and all that, because they are left with nothing but thinking, emotional drainage. you know. So that is more reason we need to invest more into preventive medicine. But what we do in naturopathic medicine is that we look into the cause. We look at the case in totality, or use the word holistically. You understand, from a big perspective. That even if you go for myomectomy, you understand, sometimes we, naturopathic doctors, will advise patients, and we will even bring in the service.
Okay, of
We even refer. Okay. We have a standard referral system.
Okay.
We work with allopathic doctor for quality integrative healthcare service delivery. If I see a very big myoma, and I know that this one is nowhere. It has to go. It has to go. See, a lot of I tell people it's a lie. Herbs cannot shrink fibroid. It's a lie. They are see me. I say the truth about natural medicine, plant medicine. I say the truth about medicine.
So some
You
people that
understand?
are saying that okay, they took one.
It's a lie. It's a lie. It can only you understand. Fibroid can only be starved. Starved. Sorry,
Okay.
starved. You can only starve it. You know, some medications have some phytochemical ingredient that can reduce some flow in that area. That can, and it is not. If you look at it the way it is, why sometimes naturally now look at a woman that conceives with fibroid. You know, during childbirth, you see that when you deliver the baby, you expect the placenta, you will not see anything again in the uterus. When you go for postnatal checkup, when they come for postnatal, we send them for investigation to check their womb and all that things, uterus and all. There's no fibroid there again. You ask yourself, where did it disappear to? Because fibroid is an hormonal issue. You understand? It's an hormonal issue. Sometimes you just disappear. You understand like that because even during regular menstruation every month, if it's seedling, it can just disappear. You understand? Because the flow and all that. Because when the hormones are properly in the right volumes and proportions, your body will work well. That is the basic thing. And if you look at where are these things coming from, where are these whole problems coming from? Diet and lifestyle.
Diet and life. I think if we are going to take anything out of today's interview, it's been diet and lifestyle. I'm not going to allow you to go until we talk about one thing again.
Okay.
So when is it going to be like a problem? When you are married for a year and there's no baby, and it's not that you and your husband decide not to have baby didn't just come. Is it 1 year, 6 months that you should be looking at the fact that okay, is there a problem? Or maybe 2 years. I mean, so is it going to be?
I get your question.
3 months?
And if fertility case is established when you have been trying to conceive for 6 months and you are not able to conceive, it is now
6 months.
It is a standard that when you have been trying to conceive for 6 months and you are unable to conceive, it becomes an infertility case. Then you need to go and see your physician. You need to go and see your doctor. You need to go and see a practitioner in that field that can help. You understand? That can help.
For 6 months,
you need to seek
for
help.
Baby, there's a problem.
There's a problem. It's said to be an infertile. There's infertility. It's said to be an infertility.
Let's talk about the infertility in men as well. So I don't be like.
No, that's why I said that on this show. I just do you know that male infertility is growing like wildfire.
Because it's only women.
Yeah,
no problem.
Wow. You understand? A man having strong erection does not determine that they can impregnate a woman. There's so many women are suffering. Do you know that? They are suffering because so many men will tell it's your fault, it's your fault. Why is their fault? Why is their fault? They are saying it's your fault, and it's their fault.
But we don't know.
It's their fault. And when you go for a medical checkup, you now begin to see that it's their fault. A lot of men working with azoospermia with big chest.
With 6 packs.
With 6 packs. You say Amatan. You understand?
Doctor has said too much on Instagram. That's why.
You understand? Amatan. You understand? You understand? Bó ṣe tóbi sí òdà kò mean pé ó lè fóbìnrin lóyún. It is the morphology and the quality of the semen of the sperm cells that determine fertility in men. Ẹ máa rí cell mi lórí microscope, kò ní lórí, mi no tail, things like that. So male infertility is growing. See, sometimes I think, let me say this on this show. Sometimes I begin to look at, we are not seeing that something is coming. Òjò kan ń bọ̀. A wind is coming when it comes, to Africans, to black people globally in the world. Globally. We are not beginning to see this infertility issue, particularly even in men, as a major thing we need to come together and have a summit on. Have a discourse. And look into the causes. We in naturopathic medicine, medical sciences, we have our own. We know so many risk factors of these things. But that will be for another day.
So apart from those
now,
what else can cause infertility in men? That's the
The
only
low
thing.
sperm count is the disease condition or oligospermia. Are you get what I'm saying now? Low sperm count.
Can
Low
they?
sperm
How can
count.
they know? You know, they
So
might
many
not.
men are even working every day with infection, chronic infection. You understand?
Is it STD
Some
that
are
cause that?
congenital. STD can cause it. STI can cause it. You understand? Most of this time at long term. You understand? That is why regular checkup is very important. That is why don't marry that brother if that brother does not go for test. Don't marry that sister if she does not go for health checkup. And I'm not saying there should not be understanding of marriage. You understand? Even when there is an issue known. But it is for you to know your faith, for you to know where you are going, so that you can solve the issue together.
So I
There's
feel like
nothing bad there
just
in
marry, you love each
transparency. But
other.
in
Even
this
love
part
is.
of the world, we marry in blindness and start suffering after marriage. And you say your marriage is not sweet. But when you know from the beginning, your love itself will tell you if she can go on or he can go on with the marriage.
So I think we are much of love. Okay, we are fine. The fact that the person is beautiful doesn't mean that he or she doesn't have a problem medically, and we try to sweep it under the carpet, or we just think that we are fine.
My dear, Odo tó ń bọ̀ yìí, this 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 thing on Africa. No, I speak Yoruba because I'm a Yoruba man and
No problem.
I love it.
Yes.
And I'm not
This is
too
YouTube.
educated not to speak my language and make people
Definitely,
understand what I'm
definitely,
saying.
definitely.
And what I'm saying basically is this: we are not beginning to see this as issue.
Hmm.
This male too, because we are royal people. We are Africans that believe that we have kings. The child of a king becomes a queen and becomes the king. We are ancestral people. When we are beginning to embrace so much of ART, you understand. And I'm not saying we should not embrace ART, or I'm not condemning ART, but we are Africans. We should begin to look into the cause of our problem. The way it is for young girls at puberty, young guys at puberty too. You should educate them that there's what we call oligospermia, there's what they call low sperm count, there's what we call azoospermia. You understand? In fact, start doing sperm test at the age of 15, 16, 17.
You tell any parent, you like,
Critical, you are
do you want
exposing
to
the child.
expose? Of course.
But this, if you don't expose the child to know and educate, just like when we're saying, don't tell the child about sex health. Now it's now global now. It's now a normal thing to tell the child about health, about sexual health. You can also make it go to that level, or making it mentally look like, psychologically look like that. Just to make it a preventive method
Before it
before
gets
it
out of
becomes
hand.
out of hand. We are Africans.
So how long can
Now we have
it be
sperm banks, we
treated?
have all these things and all of the other
How
things.
can it be treated? How long can it be treated? Like, okay, after the guy or in question already knows that, okay, there's this low sperm count. So when, like, how many years are we looking at? Okay, if it is treated this time, maybe at this time, this thing can continue.
Now, basically, that cannot be determined
Ah.
except no. I'm not saying that cannot be determined, but I'm saying that depends on individual the case.
Okay.
In
How
some cases,
severe the case
yes,
is? How
how acute or chronic the case is.
Okay.
That it depending on the case. You understand?
Okay.
That is what we do. When we see the case, we know we can now reassure the patient that okay, after 2 month, 3 month treatment, you will be fine,
Okay.
and they will see that they will be fine. They will conceive.
Okay.
We tell the lady too that okay, this is what we are treating you for. After two things, the hormonal problems and all that will get better, and they will see. You understand? We look into, you know, in the medical view, what are the other way out of all these things? There's so many questions that medical science cannot answer. You understand? We reassure you that there's hope, even when our colleagues or some people tell you there's no hope. We tell you there's hope, and we look for the hope for you, and you have the hope, and that hope becomes a reality.
Thank you for giving hope, sir. And trust me, I think I don't know about some doctors. I think some doctors, because what we were taught in school that a doctor should reassure their patients. But this year, I think doctors are the one telling you, you have just 2 months to live. Do you think that's that's good? When a doctor is like, the person is going to die
Anyway, it
tomorrow.
all
I'm
depends.
not saying they should not say the truth, but sometimes you be like a particular doctor that I used to tell on Instagram, like, I don't like the fact that you are telling me that they will suffer. I be like, oh, they will suffer now. I'm like, no, I'm like, they will definitely. But when you tell, maybe because my own love language is word of kindness. And I think everybody likes to. I mean, even if you are going to die tomorrow, there's a way you are going to say it, and it's not like you guys are going to die. What do you think about doctors these days that just say, oh, well, 2 months time, and what if those people didn't die in 2 months time? I mean, I can now see that doctors are beginning to be too factual these days, which they should, but I think the way some doctors go by it is like, madam,
let me be open-minded.
oh yeah, please, we want you to.
About this discourse.
Okay.
I think basically doctors too are human beings. Blood runs through their veins.
Okay, so you need to.
They have their own family pressures too. Sometimes doctors are not even in the right frame of mind. They just try. So sometimes the way they present some of these issues are not intention. Is not intentional.
Okay.
You understand? It's not meant to hurt you.
Okay.
But in everything, a good doctor must know how to manage pressure. Must know how to still calm, even when you are crying inside as a doctor. You must know how to smile to give people around you hope. That is what I was trained to do.
I remember a particular doctor, he was so impatient that
trained.
he was just handling the baby anyhow. I'm like, doctor, easy now. He was even looking for the veins, and the veins was here, and he already. It was just, I mean, we were all like.
The whole concept of medicine is clear. The whole unit, just like a unit of something, the whole concept, just like the unit of carbohydrates.
I think we are not saying doctors that really don't care.
You understand?
Like,
I think it's just personal issues. It's not a generalized issue. I would not say that because, but what we do in naturopathic medicine, what we do in my practice is that we do more of patient care. That's why we are very soft with our patients.
That's why your patient can like you, right?
We do more of patient care because we understand that the real medicine is care.
Okay.
When you care for your patient to the level that we are interested in your emotional pains in my field of medicine. We are interested in your psychological pains. We want to know you better. I get my point. We want to know you better. We want to feel your pain so that we handle the case like a project, and most times we get good results. That's why, because we see it like a combined project.
Okay. So you are working
One of the
alongside
principles of my naturopathic medicine is doctor as a teacher. We educate you. When you come to the hospital, we don't just tell you, oh, you have, okay, go for this. Oh, inpatients, we know not do like that. Go for this test. Come back. Okay, madam, you have this. Go take this one. We educate you about every stage.
Okay, so
madam, this is the reason why you need to go for this test. You're already educated about it. Well, this is why when we are giving you medications, natural remedies, or any kind of therapy, or prescribe a therapy for you at home, or we give you any form of interventions, because I give interventions. You understand?
Doctor, there's another thing again that I can't live here without talking about cancer, breast cancer.
Can we put cancer another day?
Yeah, I know it's going to be a long talk.
Cancer is another
long talk. For me, what the breast cancer, we have leukemia, and I know like 2 people that had leukemia, they are dead now. I think leukemia, is a particular cancer that, the patient knows that
Tomi, I will just say this.
Okay.
And I want you to reschedule another interview for that cancer, because I don't want to go into it deeper now. Because it's another
deep conversation.
Yes.
Just give us a brief of all this cancer breast.
That's why I say women go through too much. You understand?
Should you do chemotherapy? Because everybody like, don't go for that chemotherapy.
I cannot say anything against
chemo
medical protocols, because I'm medically trained and naturally focused as a naturopathic physician. You understand? And I will not say anything against most of these protocols. We can't generalize issues. That's just one thing I want you to know. And but at every point in time, the patient case will determine the next step, or the step the doctor will take. If I see a case of patient A, I will not determine patient B with that same case. You understand?
Their cases are
even when they have the same breast cancer, I will not handle it that the
That
same way,
same.
because there's some other things that will present differently. You understand? And I think, like I said, let's talk more about how to prevent breast cancer.
Hmm.
What are the risk factors?
Yes.
Environmental factors. Nobody's talking about it.
How do we
Organic,
prevent
chemical.
it there? How do we
No,
prevent
no. You don't want to talk about prevention.
that? These
They
are the
are
things that you
not.
can do that
No,
breast
no.
cancer can't even come close.
Uh, Let me say that there are things you can do to make you healthy, and when you are healthy, your immune system will not come down, and cancer will not come up, and you will not be at the risk.
Of getting.
Let's say risk factors is to take away environmental factors. Our phones are also part of cancer.
Oh, wow.
Radioactive. You know, radioactivity and all of that. You understand? Wave. All these things can mutate cells, can change DNA formations.
Mm.
These are things. Technology affecting human health is not new to us. Let me not go to the issue of this GG and G. You understand? But we know these things. We do these things. We don't look into the health risk. It's like we are creating health business for the 20, 30 years to come. From this technology we keep bringing on board, not considering the health impact assessment of all these things. You get my point now? So on the breast cancer issue, I think what I would just say much women should invest more on preventive medicine.
Mm.
Start knowing that as a woman you are at the risk of having breast cancer. Start knowing so that you can start eating healthy and living healthy to prevent it. And taking note of environmental factors that are risk factors to having breast cancer is key. So when you begin to look into all these things, it's the first step.
What do you think women should eat?
Women should um,
You like sugary things, right? Some
women
women like
should
sugary things.
women should know. Generally, like I said, in my own practice, we don't generalize.
Okay.
It's an individual thing, and that is why we give individualized treatment.
So we can't say okay.
In fact,
then she
in a
eat
branch of calm medicine, there's what we call homeopathy. We have a part of the organon of medicine. We call it organon of medicine in homeopathy. No two patients, when they present even the same symptoms, that we have principle, and this principle works for us in our practice. You get my point now. So what I'm saying to you is this: the information I'm giving you, you understand. I will try as much as possible to give an individualized information. Know yourself as a woman. Know yourself. And how many women out there know themselves? They don't know themselves. These our young girls, they don't know themselves. They don't know when they have their menstruation. They can't remember. They don't know when they are ovulating. Know yourself. If you have any complaint, don't take it normal. Seek for help before it deteriorates.
So I think sometimes we leave some things.
We care less. We are not health disciplined.
So we should be health disciplined.
We should be health
We should not
disciplined.
take things for granted. Like, oh, something is going somewhere. I have.
If we have a military view towards our health, this disease conditions that we talk about, cancer has a military approach. If you see cancer, it has a military approach.
And
We don't have that military health approach, healthy approach to even prevent it. You understand? And to begin to have those things, you will not, So basically, women should know themselves, stay healthy, drink a lot of water, know the food that is compatible with your system.
What of people that don't, yes, I understand.
That's why I say it's an individualized thing.
Some people are like, okay, you eat the same thing over and over. You don't want to explore food. Like, okay, I not try this. This is.
You can explore.
Okay. So far,
exploring does not mean that most of the things that harm us are things we do every day. Most of the things that harm you are the things you eat every day. Most of the things that affect you in all ways in your life, emotionally, physically, in many ways, are things you do regularly. Are the things that affect you. You understand?
Yeah,
So when you begin to watch all these things, it's the first step to good health and wellness. Watch it. Watch it.
Doctor, I have another question, but I think you're good. This is 50 minutes already, and we are in fact. But I think this is a convenient time to just say it's a wrap. Thank you very much for
You're
coming.
welcome.
Lovely is it's not the usual, right? And you are like to me. But I think all of us we've all learned one or two things, and like doctor said, we are what we eat. So we should eat right, and we should know ourselves. We should not explore any food that is not good for our body. Very important. And he has said a lot. You guys should just go through this page and explore what he has said. If I just saying this. So thank you, Dr. Akin, for coming.
You're welcome.
So for that, I think we are going to
They
have
can
Doctor
always,
again
they
because he
can
said
always
I
reach out
cannot.
to me on my Instagram handle too.
Yes, we are going to tag you on
Okay,
this.
official Dr. Akin.
Akin.
Dr. Akin.
Okay.
Yeah.
So you see, very accessible. Official Dr. Akin. No story. Thank you very much, Doctor.
You're welcome.
It's nice seeing you.
Yeah.
So guys, oh gosh, sorry. So guys, seriously, health they say is wealth. You've heard it all from Dr. Akin. Dr. Akin said a lot of things, guys. Don't let us take our health for granted. Our health is very, very, very important. Please, and please. Whenever you discover anything, please don't let us take it for granted and be like, I know prayer is good, this is good, but still let's take it serious. Let's consult our doctor and self-medication. No. So I have a headache, so I have to take this thing and this and this. And so it's a wrap, guys. It's a big wrap today on the show. And it's not anger, this is just Tomi Unscripted, yes. And we've had Dr. Akin talk to us. I hope you find it very helpful and very interesting. I'll see you some other time soon on a special interview with another special someone, like very, very special. I'm not going to let the cat out of the bag yet, but you guys should just watch out. And next time, I don't know who the person is going to be, but at least the special person I interviewed this month on Tomi Unscripted is Dr. Akin. I'm very sure you like this and you found it very helpful. It's a wrap, and so I have to go. I love you guys for 1,000 years. See you some other time. God bless you. Thank you so much. I love you. Please, if you are not subscribed to this channel, please do turn on the notification button so I get to know when we are post new video. I know this is a very, very long video, but so sorry. I'm sorry. I know this will take your data like 52 minutes, but it's fine. Thank you guys. God bless you. I love you, and I remain yours faithfully. Oluwatomi Otakun. See you some other time. I love you.